For people with ADHD, studying isn't really the easiest thing in the world. And I know this because I have ADHD, but I also study a lot. I know that there's a lot of methods that you could take to improve your focus and deal with your symptoms without having to take any sort of medication. And if those steps work for you, I highly recommend that you go ahead and take them. But 3 years ago, I got my ADHD diagnosis and I got medications approved to help me manage those symptoms. And so this video is specifically for people who may have recently gotten a formal ADHD diagnosis and are being prescribed their medications. And I do want to state that I don't believe anyone under the age of 18 should be on stimulants, but if you're being prescribed something, you should be, aware of what it is that you're dealing with, and you need to understand, what you're really getting yourself into. You probably shouldn't be looking towards stimulants as your initial method of managing your disability. If there's some sort of lifestyle change that you can implement to help you manage your symptoms, I highly recommend you take that route because it's a lot easier to deal with than having to take stimulants. And this video is not going to be a concrete guide, but it's really just anecdotal information that I have found works for me. So this is going to be my 7-step protocol for studying with stimulants. I also want to preface by saying that you should talk to a healthcare provider and ensure that you have the proper diagnosis for whatever it is that you're dealing with. Make sure you get your medication legally, get the proper dosage for that medication, and then monitor your behavior to ensure that the medication that you're taking or substance that you're consuming is actually what you need to help you with your specific situation, because you don't want to be taking something that's actually counterproductive. It's not going to be a good idea. So step 1 of this protocol is going to be to actually know your stimulants. You're going to want to be aware of what it is that you're taking. I'm going to touch on 4 to 5 sort of stimulants that are really commonly used to help people enhance their cognitive abilities or study. The first being amphetamines, which is going to include things like Adderall, dextroamphetamine. You could be taking sort of amphetamine salts, a combination of those two. It really depends on, what you're prescribed or I guess get access to. But I don't recommend that you take your friend's Adderall prescription. Don't do that because whatever it is that they're taking might not be the best for you. So make sure you talk to your provider to understand what dosage would be most effective for your specific situation. And I don't recommend that you take stimulants recreationally, because if you need them to be productive, whenever you take them recreationally, you're going to be experiencing the same effects. Your brain's not going to know to differentiate when it needs to be productive and when it doesn't. The duration of action for amphetamine specifically is about 4 to 6 hours, and there's a lot of side effects associated with it. Loss of appetite, weight loss, you get dry mouth, your stomach could be upset, you could get pain, nausea. There's a lot of dizziness sometimes. You could get headaches. You could experience vomiting, diarrhea, fever, a lot of anxiety or nervousness, and trouble sleeping is a really common one if you take it later in the day. Some withdrawal symptoms from abruptly stopping Adderall could include things like having severe tiredness. You could experience sleep problems, and you could have sort of mood or mental changes that result in things like depression. And the reason that amphetamines are really commonly used for people who have ADHD is because they are central nervous system stimulants that increase dopamine release in the nucleus accumbens by increasing noradrenaline or norepinephrine release in the prefrontal cortex, while simultaneously preventing the breakdown or reuptake of those neurotransmitters so that the signal sticks around for longer. And people who have ADHD have a tendency to have either a deficiency in the amount of dopamine that they produce or some sort of issue with processing the dopamine that they have in order to be engaged with whatever it is that they're doing. A similar sort of stimulant, and the second on this list, is methylphenidate, which is commonly known as Ritalin. And it's really similar because it has a 4 to 6 hour duration of action for its immediate release form. Both methylphenidate and amphetamines are going to have extended release options. I believe that the Adderall extended release is going to last from 8 to 12 hours, and the Ritalin extended release is going to be somewhere between 10 to 14 hours. I'm not sure why it's longer, but I know it's a different medication, so it is going to have different sort of effects. It could have similar side effects to Adderall with methylphenidate, like nervousness, trouble sleeping, loss of appetite. You could experience weight loss. You could get headaches, dizziness, nausea, or vomiting. And withdrawal symptoms that you could experience as a result of abruptly stopping this medication could be depression, suicidal thoughts, or other mental or mood changes. And Ritalin's mechanism of action is not as clear as Adderall's, but we do know that it also prevents the breakdown of norepinephrine, dopamine in the brain. So those neurotransmitters are going to be exhibiting their effects for longer periods of time. And one of the reasons that I would recommend using an immediate release version of these two prescription stimulants over an extended release is if you have to drive somewhere Sometimes these stimulant medications are going to inhibit your ability to be able to operate motor vehicles as effectively as you normally would. And so having a longer period of time for their effects to sort of be manifested could get in the way of what it is that you need to do. But I would recommend talking to your provider to see whatever dosage they recommend you use for your specific symptoms, because some people might need it throughout their entire day and some people just need it for whenever they have to do work. The third stimulant on this medication is extremely common, and I consider it to be sort of the most accessible, kind of the easiest to get, and the best for longevity, which is going to be caffeine, which is it has a duration of action of around 3 to 5 hours depending on how you metabolize it. And side effects that some people experience could be like nausea, vomiting, your stomach could be upset, definitely trouble sleeping, and increased urination. And if you abruptly stop caffeine, you could experience withdrawal symptoms like headaches, mental or mood changes such as irritation or nervousness. And a little pro tip: if you're taking caffeine regularly in the form of energy drinks or coffee, if you need to lower the dosage because you've built up too much of a tolerance to it, I personally use yerba mate. I use the guayaki cans because they're really easy to just like buy and carry around and then just drink whenever you need them. But those have a lower sort of caffeine dosage level, but they're really effective when it comes to staving off the negative withdrawal symptoms of caffeine and continuous caffeine usage. So I don't really get the headaches. And so if I want to lower my caffeine intake, but I don't want to significantly get that irritability or headache thing that commonly exists, then that's what I do. Caffeine is a cognitive enhancer. And I would consider it to be the least harmful on this list, but it's still very dangerous if you use it wrong. All of these are. But the reason that caffeine is so effective is because it mimics cyclic adenosine monophosphate, which I'm going to refer to as either adenosine or cyclic AMP. And so what it does is it has the same structure as cyclic AMP. And what it does is it binds to these adenosine receptors. And when they bind to it, they block adenosine from binding to it. And because adenosine, when it binds to its respective receptor, what it does is it sends out a signal of exhaustion or tiredness throughout the nervous system. Because caffeine is sort of blocking that sort of signal, you don't experience tiredness, and it actually promotes the release of something called acetylcholine, which is a neurotransmitter that is I'm going to touch on in a bit. But the really important thing to understand is that caffeine is not going to give you energy. It actually just makes you perceive yourself as not being tired. It's sort of its presence prevents the feelings of exhaustion. But cyclic AMP is still being built up. So as soon as that caffeine wears off, the caffeine crash that a lot of people experience later on in the day because they drink large amounts of caffeine, as soon as it wears off, all the larger quantity of adenosine that is there that normally wouldn't be there starts to hit its receptors, because now the caffeine's out of the way, it's uninhibited, and it can just get to work. And so you're going to feel a really quick sort of influx of exhaustion. And that's what a caffeine crash basically is. When it comes to stimulating norepinephrine and dopamine, we know that caffeine can actually stimulate both of those two, which is why it's also commonly used as a study tool. The penultimate substance on this list of stimulants is going to be nicotine, and its duration of action is roughly 1 to 4 hours. In terms of cognitive enhancements, it only has a really a temporary improvement for people who smoke regularly. I wouldn't really recommend this sort of as a study tool, but I know that some people do use it, and there's different ways of sort of administering nicotine. You could get it oral administration, you could have a nasal spray kind of thing, or you could smoke it like a lot of people do. If you're smoking it or orally ingesting it like a nicotine gum, you could get mouth, teeth, or jaw problems. You could get headache or heartburn. You could experience sweating or diarrhea. You could have a runny or stuffy nose. You could get nausea. You could have a change in your taste if you're smoking specifically. Hiccups also can occur as a sort of side effect. And in terms of nasal spray administration, you could get things like a runny or bloody nose, or irritation. Watery eyes is really common, and then there's nasal irritation, blistering, or tingling that you could undergo. I personally don't take nicotine, but I know that if you're a regular user of nicotine and then you abruptly stopped, you could experience withdrawal symptoms like trouble sleeping, anxiety, depression, dizziness, nervousness, or irritability, and a headache. And those things are kind of really overlapping with a lot of the other sort of side effects of stimulants. So my personal approach to this is if I'm gonna be taking a sort of stimulant, I want to have the most effectiveness to sort of side effectiveness that I can kind of handle. I just don't feel like nicotine is as effective in terms of how short the duration of action is, and sort of how effective it is for the longevity of being able to study and improve your cognition. But nicotine is important because it has a really unique sort of method of action. It binds to nicotinic receptors, which are really, really plentiful in the brain. And what those receptors do is they stimulate the release of norepinephrine and dopamine, like all the other stimulants on this list do. But they also stimulate the release of acetylcholine, like caffeine does. And acetylcholine is really important for memory, learning, attention, arousal, and involuntary muscle movements. And Alzheimer's disease specifically has shown a decrease in the expression of acetylcholine. And so while it does do similar things, I would honestly recommend that you're better off just drinking caffeine or exercising, because exercise as a habit can also release acetylcholine. So if you want to sort of improve your mental endurance, working on your physical endurance can really give you a boost forward. And then the sort of final section of these stimulants are going to be illegal substances, which I do not at all recommend because, one, it's illegal, it's not a good idea, and two, you're not actually going to have the same cognitive increases in performance, because what they do is they flood your dopamine levels with their mechanisms of action. I'm talking about substances like cocaine, MDMA, which is commonly known as ecstasy or Molly, and then methamphetamine. Those are going to be substances that are actually counterproductive, because when we have too little dopamine, which a lot of people with ADHD just normally have levels of, they don't, they can't get engaged with the material. They don't really care. There's not a whole lot of information that we would be able to absorb because we just have no interest in it. And then when you have too much dopamine, you're too easily distracted. And so there's like a sweet spot that you want to be within, which is why it's important to not take a friend's dosage, because if your friend has a dosage that is far higher than what you need, it could be counterproductive, because you could end up getting way too much dopamine in your system. And overall, that's not going to be something that we need. We want to be able to deal with our symptoms specifically. So make sure you speak with your healthcare provider to understand exactly what it is that you need for your specific situation. So step 2 is going to be to actually set up your study plan. I recommend if you have like a Mac or some sort of Apple device, that you use like a Stickies app, because it's already on your device. You might as well use it. It's really simple. It's a sort of like just a digital sticky note thing. It's very, very bare bones, not really super complex, but I like it because it's super simple, and because it's simple, there's not a whole lot of like barrier. I don't really get lost in the weed of programming anything. You could use Notion, you could use Google Calendar, you could do all of that if you really wanted to, but I personally feel like the simpler something is, the less likely it is that I'm going to get distracted while trying to set up my study plan. And I don't want to spend too much time on any of these sort of sections, because time spent doing something is time not spent doing something else. And so I want to sort of prioritize one of the later steps. The approach that you could take with your sort of study plan is to make sure that the duration of your study plan is in alignment with the duration of action of whatever substance you're taking. And so I personally take amphetamine salts, which give me a sort of 4 to 6 hour window to work with. And so I set up an inverted pyramid sort of productivity system that is in accordance with spoon-fed studies recommended sort of system, where he prioritizes 3 hours to his most difficult task, 2 hours to a task of medium sort of level of difficulty, and then 1 hour to the easiest task that he has to accomplish for that day. That system is super, super simple. And so being able to adhere to that is really easy. I'm going to include a link to his video in the description below. But when you're planning out your study plan, make sure you take into consideration 2 things. The first being Parkinson's law, which is this idea that when you're doing task management, you don't want to give yourself too much time or too little time, because the amount of time that you allot to doing a task is how long it's going to take you to actually end up doing that task. You also want to take into consideration the planning fallacy, because it's this idea that when we prepare to do something, we have a tendency to look at other examples of similar things and think that the way that they did their thing is how it's going to end up for us. And so we tend to look at best case scenarios, because best case scenario examples are more prevalent in sort of society, because we look at success stories far more than we want to look at failure stories. But understanding that if you prepare for the worst in terms of goal setting and setting up your study plan, you're going to be a lot better off than if you were to prepare for the best situation, because you can find yourself rushing for things that you didn't really have to do. And no one wants that excessive stress. But here we go. Step 3 of this protocol is going to be to set up your music or some sort of auditory stimulation, not necessarily to keep you stimulated, but more so to kind of avoid you from having your environment give you excessive stimulation. You kind of want to just block off things auditorily, because one of the things that prescription stimulants specifically do is they really help you enhance your focus, but you can still get caught down a rabbit hole, and because your focus is so easy to lock in, any deviation from that focus could cause more difficulty in sort of shifting that focus back to the task at hand. So I recommend using some sort of playlist without words. I have multiple, and I like to do my playlist based off a subject that I'm studying. So whenever it's time for me to prepare for the actual exam for that specific subject, what I'll do is I will listen to that playlist while I'm doing my last sort of day or two of studying for that specific exam, to sort of prime my brain a little bit. And alternatively, you could use white noise or brown noise or any sort of one of those variants, because whenever you're using stimulant medication specifically, there's a real purity of focus that you're experiencing within the first few hours. And so having that white noise and the purity of focus, you don't really need any really external stimulation. So just having that white noise to block out things as opposed to sort of give you stimulation, it really, really helps you out, and you can just get into a groove really quickly. Step 4 of this particular protocol is going to be to actually take the substance. This is the easiest step. Just make sure you have your dosage correct. You take it at an appropriate time. I wouldn't recommend you take it too close to your bedtime or too early in the morning, just for reasons that I'll elaborate on further. But just take your medication. Step 5 is going to be to do something to reduce your cognitive load. I would recommend maybe taking a 15 to 20 minute nap, or a 10-minute sort of focused meditation kind of thing, just to sort of get your brain ready to just focus on one thing at a time. You want to really reduce the amount of background noise that's going on in your head. And so things like a nap or a meditation session can really help you bring yourself down to your baseline for you to studying. And if you're doing immediately after taking whatever it is you're doing, you're giving yourself a little bit of time for it to kick in. And so once you're done with your session, you just go straight into work and you're feeling the effects immediately. And so it gives you a way of sort of being productive and also maximize the efficacy of whatever it is that you're taking. So step 6, which is the most important step, it's also kind of the hardest step, but it's the most important to actually do, is to start working. This is the whole reason that we're taking this medication. It's because we want to be able to focus and be productive. And in order to do this, you want to sort of start your work with the intent of getting lost in your work. You're going to already have your study plan made. And so all you have to do is set your alarms or what it is, like notifications, in accordance with whatever study plan that is. So you're not looking at the time the whole time. All you're doing is focusing on the task at hand. And whenever it's time for you to switch tasks, then your alarm will let you know. Don't worry about that. Just focus on whatever it is you're doing, because if you can put 100% of the attention that you need to put out into the task, it makes it so much easier to retain or engage with than it would be if you were to just be constantly checking the time to see how much time you have left, because then you're gonna have time anxiety, or you could just be like, oh, I'm irritated, I don't want to do any of this, and it's just gonna be counterproductive. So if you want to be effective, you're gonna want to have to sort of study with the intent of getting lost in your work. I also recommend that you program breaks into your study plan. I recommend having a break last about 5 to 15 minutes, anywhere between then. People have adhered to sort of like a Pomodoro technique schedule, and that works for some people. But Justin Sung put out a video that's really been really helpful for me personally, where he details this idea that you can sort of track how long it takes for you to normally be able to engage with something before your brain just gets exhausted and tired of it. And so what you do is, once you reach that sort of period, you take your break then, but you keep track of how much time it passed. And so instead of using a fixed 25 minute to 25 minute study session, 5-minute break, you could be using a sort of it takes me 35 minutes to study without getting exhausted. Then I get tired. And so I'll take my break at 35 minutes, and then I can study again for another 25, and then I have to take a break then, and then I can do another 15. And some people have sort of different durations that they're able to be engaged with something and concentrate. And what's really interesting is that prescription medication specifically can help you sort of elongate that period of time that you're able to work for without having to take a break. And so you kind of want to be able to track that information so you can see over time whether or not you're able to increase the duration of your focus, if that's something that you're wanting to do. Whenever you're taking your breaks, do something that's not super cognitively demanding. You could meditate like you did at the beginning of the study session. If you wanted to meditate, you'd be bringing that sort of cognitive load down. It's really effective. Or you could even exercise, and you want to sort of think of your break period as a sort of you're running a mile, and 3/4 into that mile, you slow down to catch your breath. You probably won't be able to finish the mile as quickly as you would have if you sprinted the whole way, but you're not going to be out of breath when you get across that finish line because you would have caught your breath, so you're able to maintain for the rest of the quarter mile. And it's likely that you'd be able to run even further than just a single mile than if you were to have sprunted the whole time. I don't think sprunt's a word. Anyways, the reason that I recommend exercise specifically as a sort of potential task for your break is because exercise can also release acetylcholine, which we previously discussed. And having a release of acetylcholine without having to experience the side effects of sort of like nicotine or caffeine could be a positive element that you could incorporate into your specific study plan or study routine. And so being able to monitor that sort of information is really effective. And if you wanted to watch YouTube videos during your breaks, you could do that. I'm not against it, but I do recommend that, one, the videos that you're watching are somewhat relevant to whatever it is you're studying so that your brain doesn't deviate too much and have to work too hard to get back on task. And two, that you pick your videos that you want to watch during your study breaks beforehand. Because if you pick the videos beforehand and you're ready to work with them, then go ahead and you watch them. You're not spending all this time just scrolling through YouTube trying to find something, because the chances are you could end up going down a rabbit hole if you see another video that from like a YouTuber that posted something like for the first time in a while and you really missed watching their videos. So to avoid that sort of distractibility component, I recommend that you go ahead and you pick the videos you want to watch during those study breaks of yours. So the final step of the study protocol is to enjoy the work that you've done. Be proud of yourself. You just did a lot of work. You spent like 4 to 6 hours, maybe even 8 hours. It depends on what you're studying for. Just focusing on whatever it is that you need to do. And so what I would recommend you do from this point on for the next 1 to 2 hours is to not do anything too cognitively demanding or overdo anything that could give you too much of a dopamine peak. You want to really avoid social media for at least the first hour after you're studying, because whatever medication you're on, it will increase the amount of dopamine that you're experiencing. So if you're getting that dopamine release from the medication and dopamine release from something that normally gives you dopamine release, you're compounding that increase, and that peak of dopamine, once the medication wears off, could result in a lower trough, which could give you really negative side effects. And you don't really want to have that experience, because it's not going to make it as easy for you to get into your study section the next time. I do recommend that you hydrate and you make sure you get some food in to combat the side effects that you might be experiencing, because you're probably not going to be thirsty while you're studying. You're probably not going to be hungry while you're studying, but your body's still going to need that nourishment. And I do recommend that you get your rest in. So one of the things that I like to do is make sure that the latest time, because I'm personally a morning person, and so I like to make sure that I get my medication at anywhere between 2 to 4 p.m. at the latest, because if I take it too late in the day, then it messes with my sleep schedule, and sleep is really important for consolidation of whatever it is that you're learning. And I'm currently studying for the MCAT, and so I've been trying to optimize my sort of routine in order to not have to deal with having just like a groggy memory because I wasn't able to get a good night's rest. And so I will take my medication earlier in the day. But if you're a night owl, you might want to take it later in the day because you wake up late anyways. But as long as your circadian rhythm isn't disruptive, it should be pretty easy to sort of incorporate prescription stimulants into your routine. That's basically it. So we're at the end of the video. Video's over, but I wanted to include some extra study tips just for the sake of it. Study tip number 1 is to get yourself a hat when you're studying. I like to think of my hat as sort of like horse blinders. So like if I'm reading a book, I like to make sure that the brim is in alignment with the top of the book, or if I'm using like a computer, it's at the top of the computer, so that my peripheral vision doesn't catch anything that sort of wants me to be distracted, because you want to focus as much as possible. You want to make focusing as easy as possible as you can for yourself, because it's just a lot easier to sort of maintain focus once you have the momentum that you've been building up over like the past, I don't know, hour and a half or half hour. It really depends on what it is that you're focusing on and you're trying to accomplish. But I know that for those sort of deeper learning sessions, I like to kind of just block out my auditory symptoms and then make sure my visual stimulation is focused on only that which is important for that moment. My second study tip is going to be to avoid overstimulation when you're not studying. This might not seem like a great, you might be like, why would I want to do that? Because I'm thinking like I need my stimulant medications. I'm going to be overstimulated anyways because I have ADHD. Well, that's the thing. If you're going to be overstimulated anyways, and you know that you want to be productive and you want to make studying a regular component of your lifestyle, you want to sort of limit the amount of stimulation that you get when you're not studying, and you kind of want any stimulation to come from whatever it is that you're learning, because by making that sort of the most stimulating component of your life, it makes it a whole lot easier to engage with, even if you're not on your stimulant medications. And one thing that I found really has helped me is using the grayscale function on my phone, because somehow just minimizing the differences and vibrance of the colors for my device, if I'm not doing anything important on there, I found that it really helps me to improve my ability to, like, put my phone down and not have to prioritize having it in my hand or around me all the time. And it really makes a difference when you're studying. And I guess my final tip is that we want to make studying and good habits easier to do, and those difficult habits more difficult to do. And so one of the things that I found really helps me just sort of avoid distractions while I'm studying is to put my phone in a very difficult to reach spot, like really deep in my bag or even in another room if I can, because just eliminating the urge and making whatever is close to me the easiest thing to engage with, and making whatever's close to me important for me to engage with a lot easier. It makes it a lot easier for you to actually do the work that you have to do, instead of just like, pulling out your phone and just procrastinating, because that's a really common sort of trap that people with ADHD fall into, because we really crave those dopamine hits. And because we crave those dopamine hits, we're going to be doing that which gives us the most dopamine. But if you can find a way to make studying give you dopamine, normally you might not even need stimulant medication anymore. And I know that sometimes I'll be fine with just like a small amount of caffeine, because I've been able to maintain the studying habits regularly. Obviously, over time, I do need to go back to my sort of medications, because I might be slipping in terms of like my routine. But that's sort of one of the things that I found has really helped me just improve my ability to study for, I guess, longer periods of time without being so distracted. And I've found that it does help a lot in just improving your ability to be effective with whatever it is that you're trying to learn, if you're trying to learn something. If you've made it to this point in the video, I just want to say thank you. I don't normally make sort of like informational content. I've made like a couple of vlogs before, and this is like my first informational content video. So thank you for sticking around if you made it. If you have any feedback, comments, if I was wrong anywhere, feel free to correct me. I don't really know a whole lot. I haven't got my degree yet. I've got one semester left, but if I was wrong somewhere, feel free to correct me in the comments. I could be wrong. I might have misspoke at some times, and I just bear with me. I'm doing what I can. But yeah, that's basically the full video. Thank you so much. And if you didn't stick around, that's okay too. Sometimes I'm watching a video, I'm just not interested in it, and then sometimes I'll watch a YouTube video, go halfway through it, and then I'm like, okay, I got what I needed, and then I'm gone.